सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्तिः हरिः ॐ पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् श्रीरामकृष्णार्पणमस्तु. So we are now in the second session of the second day of COVID awareness workshop program conducted by NSS WING Ramakrishna Mission Vidyamandira in collaboration with the Students Counseling Cell Ramakrishna Mission Vidyamandira. So we are feeling us to be greatly privileged for the presence of the speaker, Dr. Kathirvel among us. So let us first introduce Dr. Kathirvel. Dr. Kathirvel obtained his MBBS 2003 to 2008 from Coimbatore Medical College, Tamil Nadu, and MD Community Medicine from the prestigious Postgraduate Institute of Medical Education and Research (PGI-MER) Chandigarh in 2013. He worked as Technical Advisor Monitoring and Evaluation, Center of Operational Research, International Union Against Tuberculosis and Lungs Disease for 1 year. He is currently working as an assistant professor in the Department of Community Medicine, School of Public Health, PGI-MER Chandigarh since 2017. His research areas are operational research, medical education, healthcare information technology, and non-communicable diseases. He is an alumnus of the WHO Structured Operational Research Training Initiative, short SORTIT training program conducted by the International Union Against Tuberculosis and Lungs Disease. He is mentoring both Indian and international SORTIT candidates. He has also obtained training on cancer epidemiology and survival methods from IARC WHO Lyon and is one of the co-investigators of 4 population-based cancer registries in Chandigarh and Punjab. He has organized various short courses like literature search using PubMed and reference management, efficient quality assured data capture using a mobile phone, and a beginner's course on geographic information system using QGIS. He is the faculty in charge of the Rural Health Training Center, Haryana, and Urban Health Training Center, Sector 50, Chandigarh. He has more than 50 publications in national and international peer-reviewed journals and book chapters. He will deliver today's lecture on the topic named Preventive Methodologies for Common People as well as people dealing actively with patients. So I invite Dr. Kathirvel to deliver his valuable talk.
It's an honorable invitation from the Ramakrishna Vidyamandira to deliver this talk, especially giving some kind of insight to the people to get themselves prevented and also save a lot of lives. So with this, I'll start the session, which is preventive methodologies for common people as well as people dealing actively with patients, which is primarily here the COVID patients. So with some small introduction, because it's not more of a technical session, it is more of a common awareness session. So for people who don't understand the some basics, I just touch upon some basics and then go into the some of the common strategies which we follow, primarily focusing on the preventive strategies. So here you can see this is a atmospheric particulate matter. So we may come across listening to the PM 2.5, PM 10, and other particulate matter. The size 2.5 means it is a 2.5 micron, and then 10 means 10 micron. So you can see in the top where you can see the measurements, which is actually in the microns, and you can see there are different particulate matters and the biological contaminants, the type of dust, the particulate contaminant, and the gaseous molecule. So which is the gaseous contaminants are the one of the very smallest size, which can go up to your the lowest part of the lung. And you can see the pollen and the heavy dust, which are actually the very bigger size, especially the heavy dust, which are very bigger size. Usually it gets trapped at the nasal cavity itself, and we actually inhale it. And you can see the bacteria and the viruses and the tobacco smoke here and the soot and other things. The size of the particulate matter. And here there is a comparison picture which is given in comparison to the hair, our own human hair. And you can just compare with PM2.5, which is combustion particle, organic compounds, and the metals, which is less than 2.5 micron. And then PM10, which is dust, pollen, and the moles, which is less than 10 micrometer. You can see inside the PM10, the size of the PM2.5, and you can see the PM10 and PM2.5 size compared to our hair. And coming to the organism size, the viruses, which is between 20 to 400 nanometer. So it is something like in 1,000 crore size. So that is the size of a virus. And then the bacteria, which is 0.2 to 2 micrometer. And it is something like in 10 lakhs, 1 in 10 lakhs. And the smaller airborne particulate, which is PM2.5 size here, and then the larger airborne particulate, which is 10 micrometer, and the pollen size is 15 to 200 micrometer, which you can see here, the pollen size, so which you can compare. So just to start with, so I hope I made some point related to the size, because it is very important to understand how it is getting transmitted. The COVID-19 modes of transmission. So most of the people are aware of how it is getting transmitted from one person to the other person. So based on this diagram, so if you see, I mentioned about the PM 2.5 and PM 10, and which we in a way otherwise when the transmission of any respiratory infections or the diseases, communicable respiratory diseases, we call. So we actually classify into the respiratory droplets, the droplet nuclei. So respiratory droplets are bigger size, which is more than 5 micrometer diameter, and which will travel not more than 1 meter, up to 1 meter only. It is something like when we sneeze, when we cough, and so we used to throw a bigger size of droplets, which most of the time, sometimes we say it is a visible thing. So, but micrometer, it is not. It will not be very visible, but when together as it is coming out, then it will be visible. It is something like a spraying. So, and then we have the droplet nuclei, which is less than 5 micrometer diameter, and travels more than 1 meter. So here it is not going to travel more than 1 meter. So it is primarily with a close contacts. And here it is going to travel more than 1 meter. It is primarily kind of airborne. So anywhere it can go and infect people, depending on the survival of the organism in the droplet. And the other mode of transmission of COVID is the direct contact with the fomites. When I touch a surface and then I'm infected, and then another person coming and touching the same surface without washing the hands, and then after the touching the surface also he's not washing the hands, there are high chances that he will get infected. So the primary mode where we are working here is in with regard to the COVID is the droplet infection, which is that is why we always say do follow the physical distancing of at least 2 meters. Or 2 gaj ki duri. And there are chances, it is not that it is completely nil, that it is airborne. It is not spreading through airborne mode. Yes, it is spreading through, especially in a closed places, and also especially in the crowded places. It even goes through the airborne mode. There are proved in some of the places. And so direct contact is another thing. That is why we always ask people to follow the hand hygiene method, indirect contact through the laboratory, and the other methods. Let us see with this basic understanding of mode of transmission, how to break the transmission. So that is where the prevention comes. It is basically, and prevention principles, which is non-pharmacological, are primarily the behavioral strategies and pharmacological strategies. I just actually categorized into two important divisions. So let us see the non-pharmacological strategies. So the Government of India, the Ministry of Health and Family Welfare, has classified some 15 COVID appropriate behaviors, which we will see in a later a small video. But the primary component is use of face mask. So it is always a problem for people, and when it was started, that people were very much hesitating to wear the mask. Even now also, people are very hesitating to wear the mask. I understand that it is a very, our country, the tropical climate and the overcrowding in everywhere, and all these things actually are matter, but otherwise to save ourselves and also others, the face mask is one of the important using this face mask is one of the important strategy, and which we need to follow. For example, if we use the face mask, then definitely, and then also follow the adequate physical distancing, then of course the chances of getting transmitted to the droplets and also the droplet nuclei through the airborne mechanism it's a kind of very low. And so of course add upon with the physical distancing of at least 2 meters, because if I follow the 2 meters between two persons, and of course the chances of my respiratory droplets reaching the other person is very less. And so if we follow these two things together, these two mode of transmission is completely reduced. And the other important thing, other mode of transmission is the direct contact through the fomite. So we follow just hand hygiene. These three things are very important strategies, non-pharmacological strategies, or behavioral strategies, because it is behavioral strategies, because which we have to follow as an individual. So there is nothing like a medicine which we have to consume. It is just a habit which we have to develop. And further, it is a respiratory hygiene. So respiratory hygiene includes like not spitting in the public place. That is one of the important thing. And then second thing is when we are coughing or when we are sneezing, and instead of just openly coughing and sneezing, let us actually use the folded elbow, and then we just cough and sneeze, so that we can actually not spreading the droplets in the open air. And then avoiding the crowded places and limiting the travels. So this is what the government also doing as part of the what you call it as the preventing the lockdown, as part of the lockdown. So let us just quickly see what is the mask, the details of the mask, and each of the strategies. Face masks, there are different types of face masks. Generically, a cloth mask, which we routinely use, I use within my home settings, and triple layered medical masks are sometimes called as surgical mask, then N95 and other advanced FFP mask. So the filtering face piece mask, which we call it as FFP mask. Otherwise, most of the people are aware of N95 mask. So cloth masks, there are various types, from the handkerchief to added polypropylene layer in the cloth. The filtration efficiency, if you see, only 2 to 38%. Means if you are using a single layer handkerchief, it will be giving a protection of only 2%. And if you're using a multi-layered cloth mask, it may go up to 38%. Once again, it is based on the material used, whether it is a towel material, whether it is a t-shirt material, whether it is silk. Based on that, the filtration efficiency actually differs, and number of layers and the degree of moisture and fitting on the face. The fitting on the face is very important, especially it has to cover the nose, and then there should not be any gap in the sides, and it should cover your chin, so that the full protection actually is supposed to, it should fit in your face exactly. And the cloth mask can be used in routine activity, including visits to common places, but not usually prescribed during the overcrowded places. Not recommended in overcrowded places, and when carrying patients with the COVID-19 and with other respiratory infections. So it will not actually going to be effective when you are actually carrying a COVID-19 patients in your home and patients suffering from other respiratory infection. And then the second is the triple layer medical mask, where it is a triple layer, means basically it has three layers. The outer side, the outer layer, which is a non-woven outer layer, filters the large particle. The center layer, which actually electrostatic absorption melt-blown cloth, filter tiny particles and the bacteria. And further, you have an inner layer, which is the skin-friendly non-woven inner layer, which is soft and anti-allergic. So this will actually, in a way, protects you from 99% of the bacterial infections. But once again, when you are carrying a COVID-19 patients in your home, then of course it is not going to protect you from getting the COVID-19 infection. So then in that case, you need to go for the advanced mask, which is the filtering phase piece mask, which we classify 1 to 3, and which will give the total inward leakage, which is between 22% to 2%. Most mask. So effective use of mask, these are all based on the observations which I made the points. Please use the clean and washed mask daily. So if you are using a layer mask, that is a disposable mask, you should not be using it more than 8 hours or until it is getting actually kind of moist. So means it is whichever is coming first. For example, if it is getting moist within 2 hours, then you have to change it. And even if it is not getting moist, then after 8 hours you have to change to the other mask if you are continuously using it. And cover the nose as shown in this figure. Cover the nose, and then there should not be any gap. It also should cover the chin. You can see the wrong method of using the mask, where people always actually don't cover the nose, and then they actually keep the chin open. And sometimes, and people also, most of the times I have seen people using the mask at the neck. So just they push down the mask on the neck and then once again actually make it up. Because for example, somebody is coughing or sneezing, and then the particles are getting actually stuck in the because this is an open area. When I am wearing the mask, this open area getting actually the droplets which is adhering to my skin. And then if I put it down, push it down, and then go to the neck, and of course it will get actually contaminated, and then the same part which is going to my nose, and then I try to inhale those things and I'll get to infected. So it is not a good practice to push the mask to the neck. And don't remove or open while speaking. That is a very common thing as a doctor when I'm seeing patients. Even today in the morning in the OPD, patients actually, as they come to the OPD and then try to get the consultation, so in front of the doctor they just actually open it. Even I see in the open places where in the parks when they are doing a walking or jogging, so as they come closer, they just open the mask and then they talk. So then there is no use of mask, of course. So please don't remove or open while speaking, and recognize the inner and outer sides. And a lot of people actually have the confusion. They remove it, keep it in the packet, and then once again they take it out. Then inside and then outside actually get changed. So it will once again you get contaminated, and then you may get the infection. And please don't share. And I also seen some of the houses where there is a common place, the masks are kept, and then even within the family also, please don't share the mask, and then you use your own mask, and then have adequate backup, and then wash it, and then use a clean mask. That is a very important thing. These are some basic principles of using the mask to effectively prevent you from the infection. So please don't think that the mask use is just to prevent you from getting challaned. It is basically to prevent you get infection, and so that you are prevented, and also your family is also going to get prevented. In addition to COVID-19, so we always think it is going to only prevent COVID-19. No, it is actually also going to prevent a lot of people from tuberculosis, which is one of the common disease in our country, and other respiratory infections are the diseases. And prevention or reduced exposure to environmental pollutions, of course, it is going to help you, and because of which a lot of chronic diseases are actually getting prevented from asthma. Basically, that is the important point, and we have to see if we continuously use, and it is not just for the COVID, and we can actually see over a period of time the reduced trend of non-communicable disease like the lung cancers, because once again other kind of cancers and the chronic diseases. The second strategy which I mentioned was the physical distancing. I mentioned why this is important. So respiratory droplets will travel up to 1 meter. So if you maintain minimum of 2 meters, the respiratory droplets will actually settle down in the ground. So then it will not reach the others, so that the infection possibility is very less. So you can see here when the mask and physical distancing is combined. So here, when you are both the persons are wearing the face mask and at least 6 feet apart, then of course the chances of infection is very low. And of course, staying in home is virtually the infection is virtually none. But yes, we are social animals. We cannot be kind of 24 into 7 confined to the houses. Yes, please do visit for the essential works, and avoid unnecessary visits outside, at least during the peak of COVID, to reduce the transmission across people. That's a very important thing. Then the next strategy was hand hygiene. It breaks the contact transmission, which is fomites, soap and water. It's a simple process, which is hand hygiene is the soap and water washing at least for 40 seconds. And it's once again, it is in our culture, otherwise also in routinely, as I was taught in my home when I was a kid. So always wash your hands before your food, and then similarly wash your hands after your food, wash your hands after your toilet, and any other activity. You go and come back, you go outside and then come back, you wash your legs and the
Hello, sir.
face and also the hands. So this is a common
Sir,
practice which we routinely do in our Indian
can you hear me,
homes.
sir?
So please do follow that, and which needs to be, if you are using with the soap, it will be very effective at least for 40 seconds. Where soap and water is not available, definitely you can carry the alcohol based hand rub that should be having at least 60% of alcohol. So we commonly use the ethanol or the isopropyl alcohol. So you can please use it, and then you can even carry in small. There are the small bottles of available which you can carry in your pocket, and then you can use it wherever it is needed, and then especially when there is no soap and water. And of course, as I said, please use it in all these occasions: before eating or preparing food, before touching your face, and after using the restroom, and others. Cleaning and disinfections, it's a very important thing, especially when you are carrying person with COVID-19 in your home. And please actually regularly disinfect your house and the other, especially the high touch surfaces. And it is very easy to stay home, isolate, and then manage people in home, but especially in our Indian homes, it is very uncommon to see all the houses having multiple rooms, and each person having this what you call it as individual rooms. So even if I go to my hometown, my parents always sleep together in the ground as we were in the kids. So that is what we practice most of the time. So it is very important. A lot of people don't have access to kind of individual rooms in Indian setting. But in that case, it is very important to regularly disinfect the high touch surfaces in our homes, and where we routinely say 1% sodium hypochlorite, which we can easily prepare using the household bleach, which we use it sometimes in the toilet, sometimes to clean the water tanks. So which we can actually just make it as a solution, and then and in with the water, and we can use it. So usually when we make with the household bleach, which will contain a 5% sodium hypochlorite, and which we can once again reduce the concentration, and even we can directly use it also. But only thing is, please use appropriate protection for your hands, because it will be like it will be causing some kind of allergy when you are using even with 1% or 5% of household bleach. So let us see a small video.
Sir, can you hear me, sir? Hello. Hello. Hello, sir. Can you hear me? Hello. Sir, can you hear me? Hello, sir. So maybe there is a network problem in the speaker side. Hope he will come back soon. Maybe there is a network problem in the speaker side. Hope he will. Yes, sir. Can you hear me?
Yeah, sorry. I'm just actually running the video.
Okay, well, so can I add the video to the stream?
Yeah, I just uploaded it.
Okay. But it is not visible. Yes. Now.
So with this, we are moving to the second part, which is the pharmacological strategies. I hope my screen is visible.
Yes, sir. Visible
Okay.
clearly.
Yeah. So pharmacological strategies, as I mentioned, it was basically drugs or the tablets for prevention of COVID-19. So we always look for, as a common person, so I always see if there is any tablets which I can take it to prevent myself from getting corona or the COVID-19. And the other one is the vaccine, which is available now in India and everywhere in the world. So let us just quickly go through these pharmacological strategies. So as maybe somebody may be looking for, yes, Dr. Kathirvel may give some kind of answer for this availability of drugs or the tablets for prevention of COVID. So if you ask me, I don't think there is any tablets or the drugs available till date to prevent you from COVID-19. Yes, there are, without evidence, we say a lot of other kind of immunity boosters. The effect of these effectiveness of these boosters, immunity boosters like
Sir, can you hear me? Some network problem is there. You are not visible and audible. Yes, sir. Now you are connected through mobile, I think. And
Yeah. I'm
yes,
connected through the mobile because there is something happened with my system. So anyway, so I'll just
so you can continue.
complete the lecture. Yeah. So it is basically we were talking about the availability of effective tablets or the drug to prevent you from the COVID-19. No, there is no drug, such drug, wonder drug available till date, and yet there are a number of studies which are going on improving that effectiveness, but not at single drug we are able to identify till date to prevent you from COVID-19 infection. But of course, you can improve your immunity, but we don't know whether that improving the immunity will protect you or completely giving you a protection in getting the COVID-19 infections, like taking a ginger tea or the some kind of extract from the ginger or from the garlic and etc. I cannot say that that is going to completely improve your immunity, and then because of which you are not at all going to get the COVID-19 infection. It has to be very thoroughly studied, and then after that only I can prescribe. And next important thing is, and one of the important thing is, which is currently available and effective prevention is the COVID-19 vaccines. There are different candidates. There are more than 230 to 40 candidates which are tested, and then of which 180 or 190 candidates of candidate vaccines are actually in the tested in the clinical trial or ongoing clinical trials. And in India, we have at least at present, the government is actually supplying two types of vaccine. One is the Covishield, as you all know, which is developed by the Serum Institute of India, and another one is the Covaxin, which was by the Bharat Biotech. And if you see as per the yesterday's the data in the COVID registration portal, there are around 26 crore people. Those doses have been taken, of which nearly 23 crore was actually Covishield, and then around 3.5 crore are actually Covaxin doses have been delivered to people, and of which nearly 20 to 22 crore people have taken one dose, and then only 4 to 4.5 to 5 crore only taken both the doses. So if you take the whole population of our country, so compared to that, around 4.5 to 5 crore nearly 2 doses of vaccine, it even gives some amount of protection. With the two doses, if you take two doses of Covishield, I'm just giving an example of Covishield, and then yes, definitely Covaxin also equally effective. And if you take two doses of Covishield, and then you are actually practicing the COVID appropriate behavior, and at least after 14 days of taking the second dose, is around 67%. And the one thing is, even if you are getting a infection, if you are taking two doses, and your chances of getting admitted in the hospital and having the severe disease or death is nearly zero, in case of if you're taking both the doses, and up beyond 22 days of your second dose. So it is actually one of the wonderful thing, because the completely avoiding COVID in your routine day-to-day practice is very kind of rare, so which we have to accept. and so we will get it, but it's something like a common cold, it's something like a common flu, which we say. Even a lot of the scientists actually said that anyway COVID is going to be an endemic. Endemic means it is going to present in the land, means it is going to present with us, it is, we are going to live with it, or it is going to live with us, and we have to adopt to it, how to actually prevent us from the getting the infections. Once again, with the upcoming mutants, the variants, we are all afraid of it, and I think Dr. Arnab Ghosh is going to talk about mutants and all tomorrow in the tomorrow session. So, but otherwise, currently we have Covishield and the Covaxin, and once again, Sputnik is also reached India, and it is primarily available in the private healthcare setup. But at least whenever, if you are eligible, and then you are getting a vaccine in your setup, please go and take your vaccine. Please don't have the hesitancy to get vaccinated, making the excuses of adverse events and other things. So that is what I will say to every one of you. Just let me connect to the because my computer got corrected.
Yes, sir, you are visible now. And
I'm really sorry for this technical issue.
okay, no problem. So, can I add the presentation?
Yeah, is it visible?
Yes, yes. So you can. Are you presenting some PowerPoint?
Yeah. Yes. So this is
Yes,
what I
okay.
mentioned, and the Covishield is actually taken 2 doses at an interval of 12 to 16 weeks. And for travelers, especially international travelers, even after 4 weeks, the government of India guidelines actually prescribes they can take it if they have a valid proof. And I mentioned about the efficacy of this vaccine. The after this 2 dose, just 2 weeks after the 2 dose, which is around 67%, and after 22 days of the 2 dose, first dose, which is 100%, nearly 100% of efficacy in against the severe disease, hospitalization, and death. The second vaccine was Covaxin, which is 2 doses at an interval of at least after 4 weeks, 4 to 6 weeks, you have to take the second dose. And Sputnik, once again, 2 doses at an interval of usually at 21 days, means 3 weeks. After 3 weeks and maximum of 4 weeks, it is recommended for the second dose. So I mentioned about the vaccination till date, means till yesterday, around 43,000 facilities across our country is actually providing the vaccination. And indication and contraindications, so people always make excuses. As I said, the contraindication, actually there are no major contraindications. I used to every day get calls, even now, I have this particular disease, whether I can take this or not. I have this particular allergy, particular drug allergy, whether I can take this vaccine or not. So those kind of inquiries every day I'm kind of dealing, and I just clarify them. There is no major contraindication for taking vaccine, especially Covishield or the Covaxin, other than allergies to the content of the vaccine and allergic reaction observed if by chance in the first dose of the vaccine. And in pregnant women, yes, of course, it is not indicated now because it is not yet tested in pregnant women. Similarly, in the children, it is not yet tested. There are clinical trials ongoing, and we are soon will get some results, and then accordingly, we will be starting the vaccination among these population also. Lactating mother, especially with regard to Covishield, yes, you can take it. But Covaxin, they did not test in the lactating mother, so you may wait if by chance you are actually wanted to take a Covaxin. So once we get a results of some other clinical trial among the pregnant and lactating women, you can take. People suffering from various chronic diseases, diabetes, hypertension, or immunosuppressive disorders like HIV, some kind of cancer, renal transplant. So all these people and people who are taking medications, don't be afraid of it. There is no interaction between this and the drugs which you are taking for the other diseases. So you can very well take the vaccine. And by chance, there are always the questions. I got COVID after the first dose, and then I just recently got a COVID. When I can take the vaccine? Whether I need to take a vaccine? So all these questions arises in case of post-COVID. Either it is after the first dose or even without any, even before the first dose, please wait for 3 months after the recovery and then you can take the vaccine. Of course, you have to take the vaccine because the reinfection, even with the natural infection of COVID-19, it is not going to prevent you from the reinfection. So that is why you need to take the vaccine, but you wait for 3 months and then you can take the vaccine, of course. And before, what are the precautions or the attentions you have to take before, during, and after vaccination? Please ensure that you are not suffering from any active infections. If you are currently running fever, cough, cold, or the running nose, please first of all get yourself tested for COVID or other kind of related infection. Then you actually you can go to the hospital and then get yourself consulted with the doctor, and then after that you can actually go for and follow the instructions provided at the vaccination site. Especially post vaccination, you have to wait for at least 30 minutes in the vaccination site to understand whether there is any allergic reaction in you. And so what are the adverse reactions? Once again, people are afraid of adverse reactions. The most common thing is, of course, because it is an injection, so you will get a pain, tenderness, or the itching. And once again, there may be a swelling or the redness and fever, which is a very commonly observed, and the flu-like symptoms. Rarely, very rarely, you can actually may undergo, and I have not seen, at least in my practice or in my setting in Chandigarh, severe allergic reactions. That means the severe swelling of the lips, mouth, throat, along with the difficulty in breathing. We call it as anaphylactic reaction, which is very rare. Once again, blood clotting. Yes, it is reported in other countries, but otherwise also the incidence or the chances of getting blood clotting like thrombosis is basically, which we call it as a thrombosis, is basically less than 1 per 1 lakh dose. So there is no need to worry. And even patients with the coronary artery disease who are on antiplatelet drugs, then of course they can take. So there are kind of adverse reactions. Of course, the severe allergic reaction or anaphylactic shock, if it happens immediately. So that is why you have to wait in the vaccination site at least for 30 minutes. Blood clotting, if by chance happens, it is usually happening within 14 days. So in case of any kind of high risk factors, the doctors will always tell you at the vaccination site if by chance they are suspecting. So coming to the one of the important other aspect, which is caring of COVID-19 patients in home. So before that, let us understand how this disease is classified. So some people say it is a mild, moderate, severe, symptomatic, pre-symptomatic, asymptomatic, all these things. So the recent guidelines from the government of India, not Ministry of Health and Family Welfare, which says there's four types. One is a asymptomatic. Means there is no symptom. We even call it as asymptomatic. So means the cardinal symptoms, which is kind of fever, cough, sore throat, throat irritation, body ache, headache, malaise or weakness, diarrhea, the gastrointestinal upset, anorexia, nausea, vomiting, loss of smell or the taste, shortness of breath or the breathlessness, and we call it as dyspnea. So all these things. So no symptoms are there, and then patient is completely normal, and the respiratory rate is between 12 to 16, which is the normal respiratory rate, and the SpO2, which is the peripheral oxygen saturation, measured using the pulse oximeter, which we insert in the finger, which is more than 95 at room. So it's basically you just have to observe, and then otherwise they can take all normal things, and then but otherwise they are isolated in the home. They should not be allowed to move outside. Similarly, the whole family supposed to be get quarantined, and yes, of course, as per the guideline, they will be quarantined, and their movements is not allowed. And in that case, either asymptomatic or the mild infection. In mild infection, the symptoms will be there, and definitely the shortness of breath or breathlessness will not be there, and the respiratory rate may be raised but less than 24, and the oxygen saturation will be more than or equal to 94%. If it is less than 94% and with increased respiratory rate, and then the high grade of fever and the very severe shortness of breath, then you can say it is a moderate disease or the severe disease based on the saturation and the presence of the shortness of breath and respiratory rate. You can classify them moderate or the severe. So moderate and severe cases we are not going to manage at the home. So only asymptomatic and the mild disease we are going to manage at the home, and those people will be, after tested positive, they will be assessed by the doctor, and then after that there may be some kind of basic investigations depending on the state's guideline, and after that, after ensuring that they have adequate facility in their home for isolating the patient, then they will be allowed to go to the home. And in some states, like in Punjab, which I heard that they are provided a kit which includes a pulse oximeter with a thermometer and the basic tablets like vitamin C, zinc, and other things. So once again, it actually varies between the states. But otherwise, how we are going to manage, we will see in the next slide. Where I said once again, this is the symptom profile in the asymptomatic and the mild symptomatic, where important thing is there will not be any breathlessness, and similarly the SpO2 will be, the oxygen saturation will be more than 94%. So in that case, in the asymptomatic and mild cases, monitoring at home is an important thing. At least you can use this kind of monitoring sheet where you can check for the presence of the shortness of breath, temperature, pulse rate, BP, if your BP machine is available, and the saturation. So saturation at least 3 to 4 times in a day you need to check, and saturation, especially important thing is 6-minute walk test. So 6-minute walk test is very simple. It's a self-explanatory. You walk for 6 minutes and then check your saturation. So before you start your walk, you just actually ensure that you have inserted the pulse oximeter in your finger, and then after that you just check and note it down what is your saturation before starting your walk, and after that you start walking for 6 minutes continuously within the room wherever you are isolated, and the patients will be asked to walk. And if after the 6 minutes, if by chance even before the 6 minutes the patient is feeling kind of lightheaded or the shortness of breath, or if at the end of 6 minutes it is the saturation is less than 94%, or there is a decrease of 3 to 5% dip compared to the before walk, then the patient has to be taken to the hospital for admission, even in any one of the occasion. That there is no need to wait for the next occasion where whether this finding is getting repeated. So please take the patient to the home, to the nearest hospital where COVID admissions are happening. Otherwise, routinely the healthcare providers or the healthcare workers, they contact them through the Arogya Setu, through the monitoring them using the Arogya Setu application or the state-specific application. And they also daily they do a call. Sometimes lady they are coming, and in the morning they're checking the SpO2 independently, and then they actually provide an action plan whether the patient has to be mobilized to the hospital or they can continue with the home isolation. So in the home management, what are the things need to be done? So as we all know, there are so many drugs which is actually are the medicines or the tablets which are prescribed. It's very unfortunate, and there are a lot of irrational prescriptions. And for example, with due regards to the mucormycosis, one of the irrational prescription we always link is the steroid use. So inadvertent use of steroids, irrational use of steroids, and because otherwise this drug is very, very easily available in our setting over the counter. We can just go and ask in the medical shop which is available. So which is actually wrong. And in case of asymptomatic and mild disease, the cases which are managed at the home, there is no need for the steroids in those patients. Very important thing. For example, if a patient is asymptomatic, what management need to be done is basically they have to wear the mask, physical distancing, hand hygiene, and the cough etiquettes. There is no medicine is needed basically, and otherwise they can take all routine foods, whatever they were taking before tested positive for COVID. And there is no need for any antipyretics, which is paracetamol, antitussives like a cough syrup and whatever it is, because they don't have any symptoms. Inhalational budesonide is once again It is one of the drug which we take it for the to actually reduce the cough, especially in the COVID patients. But here, once again, patient is asymptomatic. There is no need for this. Once again, oxygen support is not needed. Any of the anti-inflammatory drugs or immunomonitory therapy, nothing is needed. Anticoagulation is not needed, and there is no other investigation is also needed. So once again, I can say there is a lot of irrational use of chest X-ray and the HRCT in the current time. So, and once again, these all involves a risk for the patients, because exposure to the X-ray once again increases the chances of cancer. So whenever it is needed, then only we have to take it. It is rational use of the imaging is very, very important. And in case of mild infection, mild disease, where the patient is having, if you recall, mild disease where patient is having fever, yes, patient need to be given paracetamol every 6 hours. And the cough, yes, maybe we can give antitussive syrups or the inhalation budesonide only if in case of the cough is not getting subsided even after 5 days. And the sore throat is there and throat irritation is there, and the body ache, headache. So we may give some kind of anti-inflammatory drugs, and even paracetamol is kind of going to provide that kind of pain relief. And not only it is for fever, but also to reduce the pain. And so yes, of course, in case of when you are monitoring and the patient is developing the shortness of breath, we need to refer the patient to the hospital. It's a very important point. Once again, I wanted to reiterate, there is no need for steroids when in case of asymptomatic and mild diseases, because the irrational use of steroids may end up in the development of any of the fungal diseases like mucormycosis. Please be careful. And the instructions when you have a COVID-19 patients isolated in the home, always wear triple layer medical mask. And by chance the patient is actually confined to a single room, and where I am the caregiver, but I'm not going inside his room, but I'm just providing the whatever necessary kind of at the entrance of the room. I just keep his food and water, whatever it is needed, and we have independent the toilet and all. So then there is no, it's always important to wear triple layer medical mask, not the cloth mask, and discard it every 8 hours, or if it is wet, pre-treat with 1% of sodium hypochlorite before disposal of the mask. That is very important. If by chance the caregiver, that means myself, is entering into the patient's room, the isolated patient's room, then it is important to wear the N95 mask. And when isolation completed, when we call it as isolation is completed, it is 10 days from the onset of symptoms. And no fever for the past 3 days, then that is the time period which we call it as isolation is completed. But however, the patient has to be remain quarantined for another 7 days before we call it as completely cured. One of the important point I wanted to stress upon here is no need for retesting at the end of isolation. So once again, people wanted to get themselves tested. I wanted to know that whether I am negative or not. There is no need for getting retested for at the end of the isolation. So at the end of 17 days, it is completely cured. That is what our current guidelines says. So another important point is the testing hesitancy, which we observe routinely. So please get yourself tested, especially the person who are carrying the isolated patients, or any of the family member, or any time, even otherwise. And whenever you develop fever and cough, or fever, cough, general weakness, malaise, fatigue, whatever the symptoms which I have mentioned, so any of the three, so please go and get tested yourself for COVID-19 to the nearest health facility, and then just ensure that you are not actually contracted COVID at present. Some take-home messages through this session is COVID-19 can happen to anyone. Don't say that that you are actually protected with so and so. Even after vaccination, there are chances you can get the COVID-19. So following the COVID-19 appropriate behavior is important even after vaccination. Don't hesitate to get vaccinated if you are eligible. Don't hesitate to test yourself whenever you have symptoms, and the important point is COVID-19 will remain here. Always practice the COVID appropriate behavior, as I mentioned in the initial part of this session, and never and ever stigmatize COVID-19 patients and their families. And so please support them in whatever the way you can, and then so that we can actually flourish the humanity and help our colleagues, human beings. Thank you very much. I'll address if there are any questions.
So thank you, sir, for your very informative talk about the topic. And we invite the all the viewers to post their questions, if any, in the YouTube live comment box. So I have some questions from some of my friends.
Okay.
I am just putting in the YouTube comment box. You can see. Yes, sir. Can you see it?
Yeah. How we prepare himself socially, administratively,
Actually, I will
academically.
prepare ourselves. Okay.
Okay.
Actually,
Ourselves,
the question should be
socially,
ourselves. Okay, yes.
ourselves, socially, administratively, academically for next pandemic. Okay. So the important point is, for example, yes, of course, the government of India is kind of in a way assured that the vaccines will be our population will be get vaccinated before this 2021, the complete population, and there are active measures which is taken. So I will say at present time, the one is as I presented the two components. One is the non-pharmacological or the behavioral, and another is the pharmacological. So in the non-pharmacological is of course the socially. It is basically how we are going to behave as an individual in the society, as part of the society. How I'm going to behave, how I'm going to follow the appropriate behavior. That is a question mark always. And the next is, at least we can actually take the vaccine, and then if we vaccinate even 70-80% of the population, if we could, and then of course we can be able to prevent the next pandemic happening of the next pandemic. That is an important thing. And in a way we have to be we have to say that we are very happy that the RT-PCR and all, if by chance in a way COVID actually brought it to the district level, even some of the places even below the district level, and which is getting actually used for a lot of other diseases for the rapid diagnosis. So RT-PCR is one of the technology which we are going to use it for a lot of other diseases, for very early detection of the diseases, so which may actually prevent the other kind of epidemic and the pandemic very quickly.
Okay, sir. Our next question you can see in the screen.
Yeah. So epidemiological field workers' importance in identification factors in healthcare delivery system. How India performing in public health sector in context to COVID-19. Okay. So once again, here the important point is basically as you all know, health is a state subject, and each state is actually performing in a different way. But otherwise, the complete reorientation of the health system towards addressing the COVID-19 was done since March 2020, the lockdown period, and we are primarily kind of working on the only emergency services. Routine services are kind of hampered. Now once again we are kind of recovering and restarting the routine services. I can say that there is no single answer in case of how India is performing in public health sector in the context of COVID-19, but there are systems which is developed. For example, I will give some example of one from Chandigarh or the Haryana, and the another from the what you call it as Tamil Nadu. So in Haryana, as I know, in the initial part of the first wave, which we call it as the first wave time itself, they have identified all the high risk population. So the so-called high risk means the elderly population, the people with the diabetes, hypertension, chronic respiratory disease, tuberculosis, pregnant women, all were systematically tested. And then they were actually kind of systematic approach has been taken even for the migrant workers. And then once again, we need to understand, yes, that was a very good step, but at the same time, which we need to continue it for over a period of time, because the important thing is it is not something like a chronic disease. Once we test it, it is negative means it is negative. It is basically going to happen even the very next day if by chance the patient is in an incubation period. But still, that is a very important step. Similarly, now they have done the household level kind of sensitization and also testing of individuals using the rapid antigen test at the household level, and then identifying all those symptomatics are the tested positive and mobilizing them to the nearby primary health center, and after assessment whether home isolation or referring them to the COVID specific care centers. And the public health system once again established a lot of quarantine centers where, other than the routine health facilities, where these mild asymptomatic or mild cases, that is basically the facility based isolation was done, even in some of the places still continuing when there is no home isolation facilities are available. So there are a lot of initiatives. If we talk about the initiatives or the innovations happened in case of in the public health sector, it is very, very, very huge. We can write even some 10 articles on it.
Thank you, sir. We have our next question. Can you visualize it?
Yeah. So there is one question before the current question which was posted. So I will just first answer the question which was posted by you, which is mutant virus is anything new? Why it is so infectious? Why human immune system reacts in dangerous way? Okay. So first of all, we need to understand that the pathogenesis, the development of the disease because of COVID-19, which is not yet fully understood even globally. So that is one of the important thing. So we call it as cytokines. Some people get even test for the cytokine storm and all these things. But still, the pathogenesis, how the disease is developing after the entrance of the organism in our body, how it is getting kind of stick to our body, and then after that, where it is entering, and then what are the changes it is making in our body, which are all kind of still is under study. Very clear details are not available. That is what first we have to understand. Second thing is mutant virus is anything new? Of course, see, the mutant virus or the mutancy, or we can say resistance, we can kind of equivalent with the resistance. In the bacteria, we call it as a resistance, and once again that there is some kind of change in the bacteria. Similarly here, virus we very, very routinely call it as a mutant, and which we even have seen with the H1N1, where we have seen every 3 years there will be some kind of change in the genetic material, and then because of which we have to take the vaccine every 3 years, new vaccine which is developed based on the change in the structure of the virus. So that is how it happens. The mutancy of the virus is not at all a new thing, and which is routinely happens. There are so many reasons now we quoted by the different scientists saying that the slow vaccination may cause this mutancy, or the irrational treatment is causing mutancy, and the climate change is actually causing the mutancy. There are so many hypotheses are there, but it is kind of, I will say, some part of mutancy is kind of unavoidable. Of course, it is something like a survival of the fittest. So you are tortured to the extent, and then your survival is a question mark. Of course, you will make one or the other mechanism to bypass this, or the what you call it as combat this torture, and then you will survive. So that is what virus is also doing. And of course, when it is actually changes its structure, it will be more ferocious. As a human being, if I survive through some kind of torture, of course, I will be more ferocious, or I'll be more what do you call it as I'll get more strength or more courage to face any of the future challenges. So that is how I can actually address in a very, very simple way. So there is one more question here. If any person is diabetic or hypertensive, then how to continue these treatment along with the COVID treatment? That is the question was raised by one of the audience here. So there is no need to worry about whether I have to take the diabetic drugs and the hypertensive drugs. Actually, when you have any of the comorbidities, means any disease you have already, then please continue those drugs. The control of the diabetic status means your blood sugar control, your blood pressure control is very, very important to get an early recovery from the COVID-19. And there is it is very, very important you continue your drugs. Sometimes if a diabetic patients, if by chance we need to start the steroids, especially in case of moderate and severe cases, so we even shift from the routine orally taken tablets for the diabetes to the insulin based glucose control mechanism. So there is no need to worry. Please continue your drugs and then keep your diabetes and the hypertensive under control. That's a very important thing. And there's the next question. In this era of globalization, is there any common regulations regarding pandemic prevention control to be maintained for each country? Of course, we have already an international health regulation available. For example, for any Indian who wanted to travel to African country, they have to take the yellow fever vaccine, because we are actually a kind of susceptible population to get the yellow fever, and we are susceptible population. The environment is there, but the only thing is we don't have the mosquito, we don't have the organism here, and so that is why we are not getting the yellow fever. But in Africa, yellow fever is common. So that is why before going to any African country, we need to take a vaccination for yellow fever, and then I think after 15 days only you can travel to the those countries, because 15 days is needed to develop some immunity. And once you land there, even I had an experience of going to an African country, and before which I took the yellow fever vaccine, and in the airport itself they will ask you to show the yellow fever vaccination certificate. If you are not able to show the vaccination certificate, you will be, from there itself they will be deport you to your native place. So that is what the international health regulation is actually maintained. Now with the COVID vaccination, yes, the vaccination pass are the which is we routinely talk about in the newspapers and the newses, where if you show the vaccines, for example, why the government of India has actually relaxed the duration of second dose for the travelers is because they can show the vaccine certificate, which is taken within 4 weeks, and they can actually travel to the countries wherever they wanted to go. So yes, of course, it will be covered under the international health regulation sooner or later. But otherwise, most of the countries are actually following this kind of vaccination. Even one of my staff in my project is actually traveling to US, and then who has taken both the doses, and after that he is now allowed to go to the US. Is there any chance that of arising third wave? Is there any chance of arising third wave and also arising a booster dose of vaccine? Is vaccination is the only solution? Okay, it's a tricky question, but otherwise, yes, we are all getting prepared for the third wave, but we are just keeping a vigil of all those things. So the main question is, what is third wave? So basically, it can be an increased number of cases compared to the current number of cases. If you see from the first wave to the second wave, there is a drastic increase in the number of cases and the number of deaths, and then in the third wave, there may be once again increase. There may be increase in the cases, or it may be shifting to the other population, which we are expecting among the children. So we are in a vigil state. It means we are surveilling in all the population, and all the states are, I think, taking necessary measures. And so we don't know when it is going to happen. There are predictions, and there are some scientists are saying no, it is not going to happen. But of course, if we actually quickly vaccinate our population, maybe we can actually able to prevent a third wave. That may be one of the possibility which I kind of predict. and rising of a booster dose of vaccine once again as the mutancy develops. If by chance the current Covishield vaccine, current Covaxin, or the Sputnik vaccine, which is not going to provide the adequate protection from the new mutant virus, then of course we need to have a booster dose, or we may have to go to another type of vaccine. So for which we need a kind of community-based studies, especially continuous studies is needed. And is vaccination is the only solution? Of course, at present is. I will not say it is the only solution. It is one of the important solution. And as I mentioned already, the what you call it as the behavioral strategies, which is very, very important to be followed. It is not only for COVID, but also for preventing us from other kind of respiratory diseases. So next question is chances of becoming COVID positive for a newborn when mother found COVID positive. Yes, there are chances. But the only thing is the what you call it as when the child is in the womb of the mother, in the uterus of the mother, and then transmission of the COVID from the mother to the child when the child is within the womb is very kind of not possible status. But of course, when the newborn, when it is actually born, and then after that, of course, if the mother is positive, the chances are high that the newborn also getting positive, because anyway the mother will be feeding the baby, mother will be nursing the baby. So of course there are chances that the newborn will be getting infected, because the child will be getting exposed with all the type of transmission like droplet and the droplet nuclei and also fomites. So there is no question of what you call it as there is a very high chance that the newborn will get positive. So please describe Delta plus and Kappa variant of virus. Okay. So I will actually let us actually listen tomorrow with Dr. Arnav Ghosh. So this will be important questions. I will ask the Ramakrishna Vidyamandira to note this question to flag it with Dr. Arnav Ghosh, because he's going to talk about it anyway. Maybe I'll just say that once again, we don't want to kind of negatively quote any country or what you call it as demotivate any country. And once again, it is all related with the economic activity of the country. So we are just now actually giving the name as alpha, beta, gamma, delta, delta plus, kappa variant, and etc., which we are going to see. As the virus is getting mutancy, and then we will be giving the name in a consecutive manner. So let us actually don't worry about kind of what other variants are coming. Let's see some evidence which is coming, because it is very important, even if we get a delta plus and kappa variant, whether it is very virulent and compared to the delta variant, which we need to study. So it may, I will say, it maybe you can leave it to the academic, the scientific community, which will deal with it now, and then definitely they will come up with some answer whether it is actually very virulent compared to the delta variant or not. So the next question is, if separate bathroom unavailable, then what to do for a home isolated positive case? So in that case, as I mentioned, the disinfection, the highly touched surfaces, the disinfection can be done, and where the patient can be asked to use a N95 mask. Similarly, the caregiver, the main caregiver, can be asked to wear the N95 mask, and all these highly touched surfaces like the bolts and the locks and the doors and all these places can be frequently disinfected, either with the kind of what you call it as the 1% sodium hypochlorite, or with the even we can actually, the very important thing is be careful when you're actually especially disinfecting the switchboards when you're using, when especially you're using alcohol based hand rubs, because that may be kind of may cause some burns and the fire. So please be careful. And please use adequate kind of the personal protective things like gloves and all. And so next question is, if a person is diabetic, hypertension, Then how to continue treatment along with COVID treatment? Yes, this is already addressed, which was asked. So there is no need to worry. They can continue the treatment. There is no contraindication of taking any of the medication, especially with the diabetes. If by chance their sugar values are deranged, then definitely they may need to shift to the insulin-based therapies for shorter period, and then after that they can continue after the recovery with the routine oral hypoglycemic drugs, the tablet-based glucose control. Which is better, Covishield, Covaxin, Sputnik? So first here, Sputnik is completely, at present I will rule out because it is available only in the private sector, and it is also not available everywhere or now. So I just at present I will not discuss about Sputnik. Covishield and Covaxin both are equivalently good. For example, in a common man's perspective, initially people were actually saying that Covaxin is better and Covishield is compared to Covishield. Now the data is saying Covishield is better compared to Covaxin. So I will say at present, because the distribution system from the Ministry of Health and Family Welfare to all the states are different, and some states are getting only Covaxin, or some UTs are getting only Covaxin, and some states are getting only Covishield. So whatever is available, either Covishield or Covaxin, if you are able to afford Sputnik, you can take any of the one, and as per the schedule. So there is no need to worry which is better. Basically, if you take any of the three things, and then you need to follow once again the COVID appropriate behavior. That's a very important thing. Is it necessary to take 2 doses of COVID-19 vaccine? As news states, some information that single dose is essential enough to build required antibodies. No, as per the studies, yes, you need to take 2 doses, and we don't know about the because once again we need to have we are just studying and we are observing what is happening over a period of time, and yes, we have a different kind of cohort of group, people who have taken only first dose and then second dose is still pending, and then or maybe they got infection, and there are a group of people who have taken the second 2 or completed the 2 doses. So otherwise this is primarily to get an adequate immunity, you need to take 2 doses. That is very, very important. Next question is, can mask and hand washing prevent the spread of COVID-19? Of course, you can just actually type it in the YouTube. There are various animation videos. You can find it out how the hand washing actually prevents and breaks the chain of transmission in not only in COVID but also in any of the acute respiratory infections. Similarly, mask. So as I sneeze or the cough, even when I talk, I actually try to spread my droplets outside outside my mouth, which is in the air. So which will actually once again circulate to the nearby people, and then they are susceptible, and then of course they will get infected. So if you use a mask, once again it will get protected. Of course, these are all kind of proven. There are ample evidence are available. That is why we always prescribe use mask, and then maintain the hand hygiene, and also do maintain the physical distancing, especially for prevention of COVID. Can I get COVID-19 from eating fresh fruits like fruits and vegetables? So I don't think if you are actually adequately washing, means there is no special washing which is needed for the fruits and vegetables. If you are eating raw fruits and vegetables, and of course, as you were as before COVID also, as you were very, very nicely washing the fruits with the routine water, clean water, and then some people use household salt. They will put it for some 10-15 minutes, and after that they will once again wash with the normal water, and then they can actually consume it raw. And if by chance actually if you're cooking the vegetables, then of course there is no way that you are going to get COVID-19. Of course not. Fact and details regarding vaccine is not clear till date. I don't know what is the fact and details it is mentioned here. There are studies and there are publications available in a very, very well renowned journals on Covaxin and also Covishield. and people who can understand the scientific terminologies, definitely they can go through. Otherwise, the Serum Institute of India and the Bharat Biotech and also Government of India, they have provided all the details, necessary details about the vaccine, their contraindications, whether I can take a vaccine. There are a lot of FAQs available. Please go through it. If needed, I can also share those links, and which is available. Of course, it is available. Why people become COVID positive after taking 2 doses of vaccine? Why full details regarding phase 3 clinical trial not become published till date? Is it possible to give permission this type of administration of vaccine in any developed country? Okay. So why people become COVID positive after taking 2 doses of vaccine? So vaccine, importantly, is not going to protect anybody from 100% of COVID getting the COVID-19. So it has some kind of efficacy. Efficacy means the controlled trial setting, and effectiveness. Effectiveness, we call it as the best scenario, best case scenario. We can say it is an efficacy. The routine practical scenario is basically the nowadays what we are giving through the various health facilities, the real practical scenario. So effectiveness, of course, efficacy, even efficacy is around 90%, and effectiveness, of course, it will be less, which is 80%. So even with the 2 doses of vaccine, you will be getting protected 80%. So means there are still chances that 20% you will be getting the infection. So the reason is basically the development of immunity, which is low, which actually changes according to our individual biological mechanism within our body. So there are possibilities, of course, and it is because of the biological mechanism. Why full details regarding phase 3 clinical trial not become published till date? I don't know which one you are mentioning, but otherwise for both the trials, I think the data are available as published papers, and which now it is available, so which we can go through. Is it possible to give permission this type of administration of vaccine in any developed country? I think you're meaning that there are some vaccine which is developed in some other country without any clinical trial, which is permitted in India. I think so, which is a similar kind of things, whether it is happening in other developed country. I don't see any other developed countries, at least even South Africa actually ordered the vaccine from India. And once again, I think they have returned the vaccine because of the South African variant is a little different. And then the vaccine which we have given, I think it is not going to work for them. That is what they said, as I read from the newspaper. And so it is here we are in the pandemic, and once again, if by chance we are getting tested, the vaccine is getting tested in one population for the emergency use purpose, because we need to at least avoid as many deaths as possible, so that we can actually have a less problem in our country. So that is why in the emergency basis, sometimes we take decision, and we took decisions on taking the vaccines from which is tested in other countries. Similarly, there are some countries which even got imported the vaccine from our country. So it is basically how we are managing between countries in this kind of the crisis situation. That's all, to avoid unnecessary delay and to prevent more deaths. Post-COVID complication and deaths measure. I think the question is not completed. So I may mention about post-COVID complications. Basically, the lung damage may kind of persist for some duration, or it may actually kind of remain. Otherwise, in the community level, which I'm seeing, and then we are also doing some studies or some kind of establishing post-COVID care clinical centers. primarily we are concerned about the mental health status and also the fatigue, weakness, and other things, rather than more of a lung problems. But still, we are getting some lung issues. So we are kind of developing some kind of guideline on this. We will come to this. We will come on this later, basically. Even mucormycosis is kind of a post-COVID or the during intra-COVID complication because of irrational use of steroids or the other mechanisms which we are we are studying.
So a lot of questions have come, and thank you, sir, for discussing so well. And no more question is there in the YouTube.
Okay.
So, sir, thank you again for coming for discussing with us on the important topic. And I again thank you on behalf of the Ramakrishna Mission Vidyamandira family and NSS WING Ramakrishna Mission Vidyamandira, who has organized the nice program in collaboration with Students Counseling Cell, Ramakrishna Mission Vidyamandira. I thank you for your important lecture and valuable talk, embraced with knowledge, and we are highly privileged by your talk. Again, thanking you. I would like to conclude the session. End the session.
Okay.
Thank you, sir.
Thank you very much. I thank you, the Ramakrishna Mission Vidyamandira, for this opportunity, and also I thank you for all the audience listening to me very calmly and having so many questions. And I think the Ramakrishna Vidyamandira is doing a wonderful job on this, especially making people aware of COVID-19. And even I will be happy even one single person is changing the behavior, and then who was assistant before for vaccination and going to take the vaccine. I'll be very happy. I think that will suffice this session's objective. Thank you very much.
Thank you, sir. Thank you. Thank you very much.